Hello, hi, good morning, guys. Good afternoon, rather. Good to see you guys here. I have kept you guys on mute for now. If you want to, then say hi to me. Hello. I'm still admitting few people in. Okay, all right. So, good afternoon, guys. I think more people will join in as and when the session is going on. Welcome to the session today. Good afternoon. Today we are talking about how to make your knees strong. So before I get started, how many of you were in my last knee session? I did one a couple of weeks back. Just tell me quickly in the chat if you were there last week. I did another knee session. I taught 5 exercises that would be helpful for the knee. Today, I am talking about how to make your knees strong. This is the topic of the day. Okay, so now the reason why some of you are here, there might be many reasons, right? It could be because you have pain now, knee pain now. It could be because you've had pain in the past. Maybe you're suffering with some kind of knee issue that you think making your knees strong will help. So give me a reason in the chat. Okay, chat में डालिए. Yeah. To prevent reoccurrence of knee pain. Okay, great. As a preventive measure, super. Nice. Everyone can see my screen in big properly. Currently having knee pain.
Yes, bol.
Okay.
Please accept me as Neela Tolat. क्या कोई होता है?
Guys, keep yourself on mute if you're not talking to me, okay?
You please accept Neela Tolat on your screen.
I have accepted everyone.
Okay.
Whoever has requested, I have accepted. Everyone's in the room.
Okay, thank you.
No problem. Okay, all right. So some familiar faces today, some are totally new. How many of you are new to me? Rahul, hi Rahul. To improve run, of course. Making the knees strong is important for runners. Chondromalacia, patella, yes, to know the exercises, what can help. Some of you are new. Tell me who's new, who has never attended my session before. I'm keeping all of you on mute again because there's ambient noise. पर मुझे बताओ कि आप पहली बार मेरे सेशन में आए हैं या पहले मेरे सेशन में आ चुके हैं? I do a lot of different sessions for people as a preventive measure. Generally 12 o'clock Sunday is when I do these sessions. So if you're new, let me know. You have attended, Ravi?
Yeah,
okay.
Neela Tolat, I am new.
Okay.
Yeah.
Yes, Rahul, I remember. You've been in my running workshops. You've done a lot of sessions with me, Rahul. Yes, I remember. Mandar first session. Okay, good to know. So before I get started, quickly, I'm introducing myself. I'm Dr. Rajni Patil. I'm a spine and sports physio. My clinic is in Shivaji Park. It's called Ortho Sports Physiotherapy. And I'm a spine and sports physio. I've been working for 22 years now. The first part of my practice, like the first 8-10 years, were in the US. And post that, I've been in Mumbai. But I do consult globally. But my passion is to give a lot of preventive measures to people, okay? क्योंकि मैं believe करती हूँ कि जब pain आ जाता है तब हम अगर उसको treat करते हैं ये ठीक है, but बहुत ऐसा pain है कि हम उसको prevent कर सकते हैं, especially knee pain and back pain, easily preventable, and this is based on my experience for 22 years, right? So I think if we can prevent pain from coming, we should. And sometimes it is simple things. जो हम अर्ली ऑन कर सकते हैं जिससे पेन जा सकता है. ऑलराइट, सो any shares guys? First timer? Okay, great. Super. So I do have a PPT for you guys. So I'm going to start that. So stay with me. I'm going to keep you on mute so that there's not a lot of disturbance in the session. However, अगर आपको लगता है कि बीच में कुछ question है तो unmute करो और पूछो. Right? Don't wait till the end of the session. Let's keep it interactive, please. So I'm sharing my screen. और प्लीज मुझे बताना कि ठीक से दिख रहा है कि नहीं. Are you able to see my screen, guys? Give me a thumbs up. Tell me if you can see.
Yes.
Chat.
Yes, we can see.
Yes. Okay. Awesome. Great. अभी एक और चीज करो. Tell me if it went on slideshow. Can you see the screen in big? My slide. Yes.
Yes. Yes.
Yes. Okay. And now tell me if it moved. Did the slides move? You can see
It
the
did.
caption. Awesome. Thank you so
Yeah.
much. Okay, so here we are. This is the session today. We are going to talk about knee को अगर हमको strong करना है तो we have to think about inside out. इसका क्या मतलब है? Because knees के अंदर भी structures है ना, just like the whole body, correct? knee के अंदर के structures भी हमको strong करने रहते हैं और बाहर के structures भी strong करने रहते हैं. अगर आपको किसी टाइप की नी प्रॉब्लम हो चुकी है, पास्ट में है, अभी है, अगर आप रनर हो, साइक्लिस्ट हो, अगर आप एथलीट हो, अगर आप एक्टिव हो, अगर आप एक्टिव नहीं हो, इन ऑल सिनेरियोज नी को स्ट्रॉन्ग रखना जरूरी है. एंड व्हेन आई से इनसाइड आउट, आई विल एक्सप्लेन इन लिटिल बिट मोर इन डिटेल व्हाट दैट मीन्स, व्हाट डज इनसाइड आउट मीन, सो दैट इट्स क्लियर टू यू. But basically, this is the key to living a limitless and pain-free life. What does limitless mean to you? Aapko, what do you take away from limitless? Please tell me in the chat. ITB pain, okay. Individual pain issues we can probably look at later. But tell me, what does that mean to you? Limitless, living limitless and pain-free. क्या आप करना चाहते हो जो आप नहीं कर सकते हो? Able to do anything and everything. Rahul, in your case, to be able to run without getting injured, to keep running, injuries nahi, no constraint on activities. Yes, superb. What else? Chalo, use your chat. Tell me. Can do any activity, cycling for long distance? Yes, absolutely. Knees are a big component for runners and cyclists. Definitely. Keep cycling, yeah. No boundaries. Good. Okay, so you're clear on that. Ki limitless agar jeena hai, so you do need to have strength. Okay, that's one of the first things that you need to do. About me, I've explained to you a little bit of background about me. Some of you know me very well, and some of you are new. Basit, able to do basic exercise? Yeah, exactly. If you want to do stairs, if you want to go for a walk, ये करने को आना चाहिए. Without feeling restricted कि कोई बोल रहा है कि ये मत करो, वो मत करो. जो generally knee pain हो गया तो सबसे पहले यही बोलते हैं लोग. Trekking, yes, absolutely. Now a lot of trekking, people are more and more aware of trekking and things, activities like that. There's a lot of outdoor activity हो रहा है, उसके लिए your knees need to be strong, right? Okay. Now इसमें से अगर आपने ये myths है, by the way, okay, but how many of you have been told this, heard this? एक बार knee pain आ गया, tell me इन चारों में से अगर आपने कुछ आपको ये बताया गया है या आपने सुना है. The first thing that happens when there is knee pain, this is what is told. Arthritis हो गया है आपको? आप सब बंद कर दो करना. ओके, आपको चलना मना है, ट्रैक करना मना है, रन करना मना है, साइकिलिंग करना मना है, डांसिंग करना मना है, जमीन पे बैठना मना है, स्टेप्स चलना मना है, वॉकिंग के लिए जा रहे हैं, बंद कर दो. और सबसे बड़ा मिथ, नी पेन कभी ठीक नहीं होता. ओके, दीज आर ऑल मिथ्स, दीज आर रॉन्ग. Tell me in the chat if you heard these. Stop doing everything. That is an advice that is given. Okay, more? Tell me in the chat if you've heard these. Yeah, lot of people, na? Lot of people have heard this. सबसे पहले अगर सब कुछ करना बंद कर देंगे तो what is the point of living, na? You need to be able to do everything that you want to do. But of course, see, if your doctor has suggested because of some advanced reason, which is internal health of the knee, then obviously you have to do that. But majority of the cases में ये सच नहीं है, this is a myth. Okay. All right. So now that, okay, now why does knee dysfunction happen? Knee pain क्यों चालू होता है? Knee weakness क्यों होती है? For all these reasons. Okay, just read these. I will be talking about this थोड़ा और detail में आगे. But these are the primary reasons. Lifestyle is one of the main ones. हम अपने bones का ख्याल नहीं रखते हैं. हम अपने food habits का ख्याल नहीं रखते हैं. और food habits में क्या? Life is busy ना. Who has the time to plan your food? Micronutrients गया है कि नहीं? Protein enough body में गया है कि नहीं? This needs a little bit of work. It needs a little bit of thought, knowledge, right? इतना लाइफस्टाइल में ध्यान नहीं देते हैं लोग. दूसरा फुटवेयर, दैट्स वन ऑफ द बिग वंस, स्पेशली फॉर रनर्स, साइक्लिस्ट एंड वॉकर्स. अगर आपके फुटवेयर ठीक नहीं है, आप जो शूज पहनते हो वो ठीक नहीं है, चप्पल कोई भी चप्पल पहन के बाहर चले गए, दीज आर थिंग्स दैट अफेक्ट योर नीज. अलाइनमेंट इज अ बिग वन. आपने सुना है नॉक नीज या बो लेग्स, you've heard about that. Those are alignment issues that start happening, and because of that the knee gets in trouble. Okay, foot is a big part of it. इसमें shoes तो है ही, but along with that, अगर foot के muscles समझो strong नहीं है, हम ignore करते हैं feet को. We don't really think that feet are important. We hardly ever look at our feet. Nobody knows if they are flat foot or not. किसी को पता ही नहीं होता है ये. Okay, so this lack of awareness about our feet can cause issues. Hip and core strength. Core strength सुना है आपने, but what exactly is core? Having different leg length. Yes, Gayatri, Ganesh, sorry. Sure, yes, lifestyle में even weight gain. अगर weight ज़्यादा है, that's also going to put pressure on the knees, correct? That goes back to your food and exercise habits. Mobility versus strength. Why do I talk about this? And this is classic example I've put niche. These are two examples that I want to give you, both patients with knee pain, right? I'll tell you how both are different and different approaches work for them. दोनों के लिए knee strength जरूरी थी, okay? लेकिन approach थोड़ा अलग था. For example, Neha is the person who is very flexible. योगा कर सकती है, वो workout कर सकती है, कोई problem नहीं है, super flexible. लेकिन strength very bad. Okay, this person has knee pain. Now, the other person, Sumit, this is by the way my husband. Don't tell him that I brought him up, his case study. Yeah? But this person, Sumit, his body type is extremely tight and stiff, and his knee pain was because of that. So first I had to address his mobility, his flexibility, and then I had to work with strength. Weakness to thi, but the primary issue was lack of mobility and flexibility. Okay, are you with me so far, guys? Are you understanding? Yeah. Okay, great.
Yes.
So why do I bring that up? Because आपको पता होना चाहिए आपकी weakness क्या है, आपकी limitation क्या है. आप super flexible हो और weak हो, या आप strong तो हो, decently strong हो, लेकिन flexibility नहीं है, mobility नहीं है. Okay, what does this determine? आपकी exercises उस हिसाब से होनी चाहिए for the knee. कोई भी कुछ भी कर लिया उससे नहीं होता है. Women versus men, do you think that is a different? Does that affect knees? Yeah, what do you think? औरतों में knee pain थोड़ा ज्यादा होता है. Statistically, if we see, women suffer from a little bit more knee pain than men do. Why? There are many reasons for that. One is, you've heard this before, correct? Yes, it's a fact. The reason is that women in general have broader hip structure as compared to the rest of the body. The Q angle, what we call the hip angle, generally is broader. That's for childbirth, that nature has provided us with this. But because of that Q angle, the knees are slightly more at risk. Also, the fluctuations of hormones every month, that also puts a little bit at risk. Yes, menopause and hormonal changes, absolutely. These are the things that put women slightly at risk. Also, women need a little bit more recovery than men do. And women generally push themselves, घर का भी काम करो, बाहर का भी काम करो, हर type का काम करो, rest recovery भूल जाओ. So if that is a case, then again, knee pain is high in women. Okay, so women और men में भी ये फर्क है. Faulty exercise patterns. Everyone that I know who has knee pain, वो क्या सोचते हैं सबसे पहले, अच्छा चलो हमने एक्सरसाइज नहीं की है, चलो ये सेशन हमने देखा है, अब हम नी स्ट्रॉन्ग करेंगे, स्क्वाट्स लंजेस चालू कर देंगे, नी पेन बढ़ जाएगा. Why? Because that is not the right kind of exercise. So you want to find an exercise that suits you. You want to do basic strength before you do advanced strength. Okay, so immediately jumping on to high impact activities. Now this is not for runners and cyclists. अगर आप already athlete हो, obviously then these exercises are okay with you, but focus on foundation strength of the knee. And like I said, making your strong knee inside out. Okay, again, I've kept all of you on mute. Don't unmute yourself, please, unless you have something to tell me. Okay, clear on this? Okay, great. So moving on. If अगर आपको नी पेन है या हो चुका है, आपने इसको इग्नोर किया है, अगर आपको पता है कि आपके नीज वीक है और आप इसको इग्नोर कर रहे हो, तो व्हाट इज गोइंग टू हैपन? These are the things that we are looking at. Okay, generally बैक और नी का ह्यूज रेलेवेंस है. अगर एक नी दुखने लगता है, जनरली बैक पेन gets in trouble or the other knee gets in trouble, right? This is very, very common. Sometimes the opposite side of the hip or the same hip of the knee that's hurting, that happens. Foot pain, heel pain. Okay, people who have heel pain. There are a lot of people who are suffering from heel pain. Ye hai to pay attention. Maybe it is chronic knee pain that's leading to that. Bunions. Do you know what are bunions, guys? Foot mein, put in the chat if you know what bunions are. Bunions are basically foot का structure change होता है. So ये big toe, if this is the big toe area, वो थोड़ा ऐसा elongate हो जाता है, foot structure ऐसा हो जाता है. That's a bunion. That also is because of poor knee alignment and knee dysfunction. And but eventually what we are looking at, अगर knee को जल्दी address नहीं करते हैं, because if you think about it, knee is the fulcrum of the whole body ना, पूरे body को वही support कर रहा है. अगर नी को हम नहीं ठीक करते हैं, अलाइनमेंट ठीक नहीं है, इंटरनल स्ट्रेंथ नहीं है, एक्सटर्नल स्ट्रेंथ नहीं है, तो वो अंदर वेयर एंड टेयर चल रही है जॉइंट्स की, जो आपको पता नहीं है. एंड इफ दिस बिकम्स मोर एंड मोर एंड मोर ओवर टाइम विथ एज, जनरली इतना वेयर एंड टेयर हो जाता है कि मेनिस्कस घिस जाता है, लिगामेंट्स वीक हो जाते हैं एंड मसल्स वीक हो जाते हैं. बिकॉज ऑफ दैट, obviously then people land up for knee replacement, which is what we want to prevent, right? Okay, yeah, so some people have put questions about specific आपका जो pain है. Those questions let's address either in the WhatsApp group or we'll address it at the end of the session, right? Now, why knee? Knee, if you think about it, अगर आप दिन भर whatever you are doing other than sitting, standing, walking, जो भी आप कर रहे हो, knee is the fulcrum of the movement, not the foot. The knee is the center of the body. Now, this is where most of your body weight is going to fall, correct? So, आपका body weight अगर ज़्यादा है, सब knee पे pressure आ रहा है. So, you do need to worry, think about that. Also, knee fulcrum है, मतलब वो center है. ऊपर क्या हो रहा है, नीचे क्या हो रहा है, वो directly knee पे impact होता है. For example, अगर कोर मसल्स वीक है, बैक पेन है, दैट विल अफेक्ट द नी. अगर फुट फ्लैट है या सुपिनेटेड है, विच इज हाई आर्चेस, अगर आप फुटवेयर गलत पहन रहे हो, फुट मसल्स वीक है, ये सब नी को इफेक्ट करता है, बिकॉज इट्स अ फल्क्रम जॉइंट. This is just to quickly explain the kinetic chain. just to show you how all of this is interconnected. For example, अगर ये foot नीचे ऐसे drop हो रहा है, as a result, this bone is going to turn to support that. These changes are happening. Your pelvic tilt happens on that side. This bone rotates. This knee collapses inwards. Because of that, you see how much force falls on the knee. Okay, so because of that, this kinetic chain, you cannot think कि हमको knee problem है तो वो सिर्फ knee को ही हमको address करना है. नहीं, ये kinetic chain address करना है. Okay, we have to look at all these structures. इसको सबको strong करेंगे तब जाके knee strong होता है. Okay, so this is just how you can generally take care of your knees. Those who are athletes here, how many runners here? Just put it in the chat quickly. Runner. Runner. Any cyclists also? Just let me know some specific things that you guys need to be doing. Yeah, a lot of runners and cyclists here. Yes. Okay, both. Okay. So as a rule of thumb, runners and cyclists actually need to pay more attention to the knees. The point here that's important to you is cross training and regular strength training. Okay, keeping the knees and core strong is one of the best things that you can do if you're an athlete. Now, people who are not athletes, if you're walking, also this is important. Okay, taking care of your knees, iska chahiye to screenshot le lo, because I'm not going much into detail for this one, because this is quite simple to understand. Okay, done. Rahul, I didn't know you were a trekker also. Okay, all right. So moving on. So what is the solution? First and foremost, you want to make your knees strong. And like I said, we want to make internal and external. What does that mean? I'm quickly going to explain this to you. Agar kuch question hai beech mein, please pucho. Internal strength. Internal strength is the joint health. Internal, aapko kya kya dikh raha hai isme? Bones, you have to make your bones strong. You have to make your ligaments strong. You have to make all the tissues and the muscles around this strong, correct? This is internal health. How does the internal health, how can we improve? बाहर से हम internal health कैसे ठीक कर सकते हैं knee का? अगर हमारा internally knee strong नहीं है, हम externally कितना भी कर ले, कुछ नहीं होने वाला है. And vice versa, of course. Bones can be nice and strong, but muscles and everything alignment is off. That's also not going to help. So you have to make sure all of this is strong. Okay. What is internal? How do you make sure that internally आपका knee strong है? Through lifestyle modification. Weight कम करो, nutritionist को मिलो, blood test करो, figure out what your parameters are, BCA, which is BMI, and that detailed reporting hai. We do that in the clinic. A detailed one. If you guys are interested, please come in. We can do that for you at a very nominal cost. Making sure that all your parameters are good, protein is good. So paying attention to food, your micronutrients, that's one of the first things to do. And of course, exercise. Some kind of exercise 3 to 4 times a week is necessary. Okay, so these are some of the things that you can do for lifestyle. Supplements. Now, the first one that I've written is a glucosamine chondroitin. This is a supplement for the knee. However, supplement लेने से पहले आपको आपके डॉक्टर से मिलना है, आपको blood test करना है पहले. If anybody needs my help with that, certainly I can help you out. I will need your blood report, the most recent one, under 3 months, 2-3 months के अंदर अगर किया है तो. But you have to pay attention to these things: your protein, your calcium, your micronutrients, your vitamins, your D, C, E, and beta carotene. Okay, ये generally supplements are great, but I think that majority of your nutrients need to come from your food, just because it absorbs so much better. Okay, so do some R&D if you need to, but ideally I feel everyone should consult an expert in whatever they need. So if you can meet, if you are an athlete, then meet a sports nutritionist. If you are not an athlete, meet a clinical nutritionist. First, do your blood test, do your fitness parameters, the BMI, BCA, all that. and then figure out nutrition wise कुछ lacking है क्या, वो substitute करो. Right? Don't do this blindly. Calcium. Now bone mass. बहुत बार ऐसा होता है कि अगर बोन्स वीक है तो हम कितना भी एक्सटर्नली हम फिजियोथेरेपी करते हैं, नी पेन कम करने की कोशिश करते हैं, जाता नहीं है. व्हाई? बिकॉज इंटरनली द बोन्स आर ओनली सो वीक. Bone mass reduces from the age of 30. Do you know that? All through bachpan and your 20s, you are putting bone mass in. मतलब bone strong होते जा रहे हैं, strong होते जा रहे हैं, strong होते जा रहे हैं. As soon as you hit 30, after 30, sorry, bone mass peaks at 30. But right after that, mid 30s के बाद bone फटाफट bone loss होने लगता है. Okay, you see the graph there. That's why I've shown you the picture. This last 80-year-old lady, you see that hump. That's because of microfractures that have happened in her spine. That posture curve ऐसा होने लगता है because of osteoporosis, because bone mass ठीक नहीं है. This is osteoporosis. You guys should know what osteoporosis. This is basically bones जब weak हो जाते हैं. Okay, it first affects the knee and the spine. So if you don't have enough calcium, if you are starting to get osteopenia and osteoporosis, then this could be something that you need to address for your knees. That's how you make internally your knees strong. Alignment पे ध्यान दो. Check yourself in front of the mirror. I also have a video on YouTube called knock knees के लिए. So if you want, you can check that out. Stand in front of the mirror, put your feet together, पैर दोनों, ankles दोनों एक साथ, and see कितना गैप है. जिसको ये है उनके पैर पास ही नहीं आते. जिसका bow legs है उसके knees में इतना गैप होगा. Now this is normal. We need to see some amount of gap. Okay, so check yourself, see if your alignment is good. But if you need my help, obviously I can help you with that. Now, osteoarthritis or OA, this is an aging process. This happens. But for people, now we are seeing that early on ये हो रहा है because of our sedentary life, maybe food habits not good, footwear incorrect, for whatever reason. जो पहले ओल्ड एज में देखा जाता था वो अभी जल्दी जल्दी देख रहे हैं हम. degeneration in the knee, arthritis in the knee, it does happen. However, the way to treat it is again to strengthen your knees. The result is the same. It might take a little bit longer, but we come back to knee strength. Okay, this is basically, I'm showing you a picture of what the OA knee looks like from inside. Okay, otherwise the final option, obviously, if there is severe knee pain and functional loss, then knee replacement is the last one. But before you explore that, you should have explored everything else, such as knee treatment, treating the knee, physio, whatever, conservative care you should have done. Now, we talked about internally making the knee strong. Externally is where I come in, because this is where I showed you the kinetic chain, कैसे ऊपर से नीचे तक सब connected है. जब ये connection इतना strong है, all these muscles in between को जब हम ठीक करते हैं, correct करते हैं, muscular imbalances, तब जाके externally knees strong होते हैं. Okay, so you may not understand some of these things, but just understand that these are all the things that we have to work with. All these, and we generally start with VMO, which is the inner the thigh muscle, top of the knee का thigh muscle. Generally हम देखते हैं कि ये muscle सबसे पहले weak हो जाते हैं for whatever reason, and then it builds over time, and because this actively इसको treat नहीं किया जाता है, बाकी सब धीरे धीरे सब kinetic chain weak हो जाता है. Okay, so we have to work with these muscles. This is a VMO I was telling you about. This is the front of the thigh, this is the knee. This muscle, this whole muscle, there is a video where I've shown you 4 knee foundation VMO exercises. So check those out. That's the first step to making your knees strong. If you want, I can put it in the group so you have access to it. Okay, but that's the first step. But we have, I mean, it's obviously exercises have to build one on top of the other, right? पहले basic करना होता है, intermediate और फिर advanced करना रहता है. But this is definitely the first step to strengthening your knees. Then we want to look at core. Core is a huge aspect. जब हमारा core, back and core strong होता है, हमारे knees automatically strong होते हैं, alignment automatically improve होता है. Okay, some of you have done BBC with me. BBC is Bulletproof Back and Core, which is a course, 10-session course that I teach. I used COVID, I used to teach it online. Now I do it offline, online, hybrid. In every which way, I teach how to make your core strong. But generally, core strength पे अगर आप focus करते हो, तो this will definitely help your knees. Okay, now exercise. This is again very misunderstood. Which type of exercise to do? सिर्फ squats, lunges, planks करके नहीं होता है, सिर्फ high impact करके नहीं होता है. आज कुछ नहीं कर रहे हैं, walking से सीधा running चालू कर दिया, ऐसा नहीं होता है. Everything you have to think it out properly, take guidance and then do it. You need to make sure that जो भी आप exercise कर रहे हो, that is scientific, structured and customized to you. Okay, please make a note of this. It has to be scientific, structured and customized. What do I mean? Just randomly doing some exercises are not useful. Rahul, thank you. Yes, I'm aware that you had done the BBC. You've done basic core and advanced core with me. And yes, exercising in the pool, swimming, water aerobics, this is good. Please remember that water exercises, aquatic exercises, help with knees in a very gentle way. So it helps for those people who have maybe some degeneration, some arthritis, but it doesn't help strengthen the bones. Please remember that. So you may need to do a combination. अगर आप water aerobics करते हो, aquatic therapy करते हो, तो साथ में you need to do something else also. But it's excellent for core. So swimming is good for the core. Walking, running, cycling, also great exercises, great things to do for your knees. However, make sure that you're doing some supportive exercises, strength training आप उसके साथ कर रहे हो. Okay, now, generally when I teach knees to be strong, I showed you the first step, उसका video आपके पास आ जाएगा, वो at least आप try करो. But generally हम sequence ये रखते हैं, single muscles हम activate करते हैं, strong बनाते हैं, isolate करके first activate them, then isolated muscle strength, फिर compound exercise. Example of compound exercise are planks, squats, lunges, single leg stance, all that stuff. Okay, and then focus on muscle recovery and release, and then comes single leg stability and plyometrics. Some of these terms might go upar se aapke liye, it's okay, you don't need to know these things. What you need to know is that it has to be a step-by-step thing. Sub exercise ek saath karne se it does not help. Okay, so I'm going to stop my screen here. Okay, so questions. What questions, guys? You can either put it in the chat or unmute and ask me.
Can I ask?
Yes.
Okay. So I've been attending your sessions earlier as well, some previous session as well. So
Sure.
regarding this one, I have a, my base is in athletics, that too in sprinting. And recently, what I experienced, currently I'm 38. And recently what I experienced is that when I pull the track, when I have to pull the track under my foot, I find that there is some, kind of, I don't feel that kind of power that I'm pulling with the other leg.
So one side is less than other, like that?
Yeah, I mean, previously it was normal, it was balanced, but recently I find, and that too, I can name those areas, those zones. One is just behind the knee, some of the like side ligaments maybe, and one point is just the connecting area of glute and hamstring.
So again, for sprinters, you need explosive strength. You don't just need functional strength, you need explosive strength, you need agility. Okay, so that is quite advanced. You should be doing plyometric stability. Your kinetic chain needs to be very, very strong. Your foot muscles need to be very strong, intrinsics of the foot. So if this somewhere in that kuch connect is gone, is not strong enough, then it can, then this kind of problem you can see.
So, I mean, I'm now starting my new off season. What do you recommend, that how should I plan, or how should I periodize?
Yeah,
this?
yeah, of course. So in off season is when you will, this is excellent time to work on that kinetic chain. Na? So you wanna definitely do an assessment first to figure out where, what is deficit, whether it's coming from your foot or it's coming from your core, it's coming from your hip. It's hard for me to say, right? An assessment needs to be done. In fact, somebody has asked a question here, is there any test to check the health of the knee? Yes. So there's not one test. You have, so sports physios, I mean, that's what we do, right? When you come in for a consult, when we're checking your knee, the whole kinetic chain is checked, your mobility is checked, your strength is checked, all that, your gait, your walking, your running, all that is checked. उससे समझ में आता है कि what is missing. Then focused exercises for those you need to do, and then obviously you hit the gym and you do more plyometric type stuff. You understand plyometrics, obviously, right?
Yes, I
So that has to be the last step. You need to do single leg things a lot. You know, so first do mat stuff and then advance to kneeling stuff and then standing stuff and then plyometric jumping, like that.
Okay,
So
okay.
that graded thing, if you do, absolutely it will go.
I get an idea, and thank you, Rajni, for that.
Sure. Okay, more questions. Some of you have put more questions.
Ma'am, can I put up the next question?
Sure.
Ma'am, I'm Vandana this side.
Yeah.
I want to ask a query regarding my mother. She's around 69 years old. And she has been having this knee concern for quite a few years now, because initially we used to stay on 6th floor. And she was really scared of the lift. So she used to go up and down using the stairs, not very often, but whenever, like you can say twice or thrice in a week, if I can give you a very accurate frequency of her movement.
Sure.
So as a result, what happened, now we consulted a few ortho specialists from various hospitals like Max and all, and the cartilage in her right knee, it's almost like it's not there. The cartilage is almost gone.
It's worn out. Yeah, so this is classic degeneration, right?
Yeah, so initially she was having excruciating pain in the right knee, and now because the entire pressure was on the left knee, now the left knee also has started. Yeah, so every doctor, ma'am, is suggesting for a knee replacement surgery, and she's too skeptical about it, because of which we are not able to convince her to go for it right now. So what can you give? What suggestion? I mean, if you can just guide us regarding the same.
Yeah, so if you have x-rays, then you can WhatsApp it to me. Sometimes I have to see both. I have to see how much degeneration is in the joint, whether if it is exactly bone on bone, it's completely worn out, obviously, then replacement ke alawa choice nahi hai. But if we feel that it's not so bad, and if we can strengthen the knee muscles around, and if we can strengthen her lower back.
If physio can work for her, anything but not the surgery.
Yeah, of course it can be done. It can be
so, ma'am, you'll be sharing your number in the chat box, or like
I'm in the group. I'm in the group. You're in the group, Vandana, right?
Yeah, I am like in the meeting group. Yeah, I'm there. But
no, there is
any other group that you
will be in the
No,
WhatsApp.
I am not there, ma'am. So should I share my number on the phone? Like, will you add me there?
We'll find you.
Okay.
You've registered for it, so we will find you. Don't worry.
Yeah, right. Thank you so much. Thank you, ma'am.
Sure.
Hello, can I ask a question? Leela Tola here. Can I ask you? Yeah, I have done TKR on both my knees.
Okay.
And after a few years, they have started swelling, and I get warmth in them. I feel some hot liquid is moving inside. Is there any cure for that, or any exercise?
So it needs to be checked with an ortho first. X-ray, MRI needs to be done, because it sounds like there is a lot of inflammation inside.
Yes. I had done arthroscopy and given the fluid for all different tests, but all were negative.
All were negative.
Yeah. So synovitis was acute synovitis was. They say you have that. So is there any exercise where I get swelling gone and
Yeah. So
the
definitely
stiffness?
again, you try those 4 exercises that I'm going to share in the group. You can try that. However, the best way to address any kind of knee issue is to get it checked, right? To evaluate, get it evaluated. So if you have a sports physio near you, if you want to consult with me, I'm happy to do that. I am in Shivaji Park, Dadar, Mumbai, but I do consult online as well. So think about it, but I think try these 4 exercises first, see if you get any relief, along with the ice pack. Okay, so guys, some of you have been decent enough to put your hand up. I'm going to ask you. Rajiv, you have a question?
Okay, thank you.
Good afternoon. This is Rajiv Goswami.
Yes.
See, I do a lot of marathons. I run about 30 to 40 kilometers a week. Do a lot of, as you suggested, doing strength training and all those things. I normally do all those things. And you also said that there is a pain between it starts with the knee, it goes up to the back.
Yeah.
The problem that I am having is on my left knee. When I started running, I did some excessive running. So because of which there was a tear in the ligament on the left knee.
Okay.
I was advised not to do any squats and jumps. So
Right.
I did that and did a lot of physiotherapy in the form of stretching my knee, then gradually putting on some weights and then doing the leg extensions. Because of that, I recovered a lot. Again, I started running, but I still feel a little bit of weakness. I still do not do squats and jumps. So
the knee still feels weak, you're saying?
A little bit of weak. The left knee in particular.
Okay, got it. So see, if this is your assumption that the knee is weak, then obviously you need to work with knee strength, right? And the first muscle to work with is your quad and your glute. So if you know what those are, then I would do isolated muscle work for that. Because you're a runner, you probably have a good idea. So start working on your glutes first and then work on your knee, which is your VMO. And then obviously if you need additional assistance, you can WhatsApp me.
Right. Thanks a lot for the suggestion. I got your message.
Sure.
Doctor, can I ask you one question?
Just 1 second. Rachna, you have a question? Let's go to Rahul. Doctor?
Yes, ma'am. Good afternoon. Nice to connect to you after a long time.
Yes.
In one of your classes, you had mentioned about VMO insurance. It is an insurance for the knee. So I am not able to recall what exactly you meant, what exercise particular as an insurance you meant for long term to prevent all these degeneration or way and further problems, age-related problems or running-related degeneration or whatever.
So for that, the VMO strength I was talking about, which is the quadricep muscle strength.
Okay,
so basically, if we work with, I don't think that is not for everyone, that's not the first place to go to. Okay, it needs to be for runners. I prefer that you work with your glutes first and then come to the VMO, like how I advised you.
Okay, yeah.
But for everybody else, I feel starting with working on your knee VMO exercises first can sometimes give you great results for a long period of time.
Okay, got it. Thank you.
Praful?
Can I ask the question?
Sure, Mr. Prakash, right?
Yeah,
go ahead.
Yeah. I'm Neela's husband.
Please go ahead.
See, I'm 81.
Okay.
And now my right knee, inner side, right knee, inner side has started paining.
Okay.
I can bend my legs to the extent of about 135 to 140 degree.
Okay.
But not completely. While the left leg, I can bend completely and touch my hip also.
Okay.
So now I'm doing regularly yoga and pranayam for 6 days.
Okay, so what I'm hearing is there is a movement loss in the knee. Okay, now
Yeah.
there are many reasons for movement loss. So you will need to get X-rays done to see if the loss is internal, joint related, or if it is muscular. A physio can probably check that for you as well, but get an X-ray done to see if it's internal first.
I haven't done the X-ray or anything.
So that's what you need to do first, so that will help physio to guide you further. But unless that knee range of motion comes, it's not going to be a proper functional knee. So definitely need to make that equal as the other knee. That's why God gives us 2 arms, 2 legs, so that we can compare. जो जितना यहाँ है यहाँ होना चाहिए. Okay, so try to make that as even as possible.
Okay, thank you.
Sure. Praful, go ahead. Praful has put his hand down. Vishwanath?
Yeah, thanks, ma'am.
Yeah.
I'm 44 years old.
Okay.
First time attending your session, finding it very insightful.
Sure.
Couple of things. In the last 1 year, I have ramped myself on the badminton front 3-4 times a week, playing on a wooden court. What I sense is the mobility is there. As you mentioned, mobility and strength, 2 things. Mobility is there. Strength also probably is there. But from a long-term perspective, I'm sure you are understanding my question. How do I build up on the strength? What I sense is when I take the steps, I see some sort of a knee thing. I think I'm able to communicate to you. While walking, it's not much of an issue. Whenever I play, I try to cool it off with an ice pack or something. But what's a proactive measure from a basic strengthening perspective? And is this a concern that after the play, probably a few hours? Yeah,
it is a concern. It means that whatever activity that you're doing, the musculature is not strong enough to withstand.
One important thing I mentioned to tell you is I have had rheumatoid arthritis in the last 5 years.
Okay.
But recently there are no issues. There are medicines which my rheumatologist. Pardon?
It's in remission, so don't need to worry about it.
Yeah. Please, you are telling me something.
So so definitely need to make sure that the muscle imbalance is not there. Okay, for a long-term perspective, then you want to, the kinetic chain that I explained, start focusing on your core, because when you are doing any kind of that kind of sport where there is movement, you want to make sure that your glutes and core are strong. So I would start working with that first. But my advice to everyone is that I'm putting everyone on mute. My basic advice to everybody is that you should have a baseline. You should know what your strength is. How will you know strength unless it's tested, correct? So get that baseline done, like one assessment done first, so that you know where you stand, and then you address the right things. Instead of अभी समझो ऐसा हो सकता है कि core strong है पर knee muscles weak है, लेकिन आपको पता नहीं है आप core पे काम करते जा रहे हो, right? So that should not happen. You're wasting your time, but you're also making the muscle imbalance worse over time. So so get that done. But in any case, from what I'm hearing, maybe footwear correction might help, but strengthening your core is where I would go first for you. Okay. Next question, let's take from Jignesh.
Yes, good afternoon, ma'am. Ma'am, I get knee pain, and then I go to the orthopedic doctor, and he advised me to take the calcium and this painkillers. So I will take that, and then after say 10 days, 15 days, it will be okay. But then after say 3-4 months or after 5 months, again there will be some pain or something like that. So should I have to continue this Calinita, that calcium supplement continuously? And also I have the problem in my right shoulder. So I don't know what are the blood tests.
Jignesh, I don't know your case that well. So it's hard for me to judge whether you should keep taking that, not take it, that you get it. We've just met today. I don't know you that well. I don't know your knee that well. So if you can send me some reports, if you're able to come check it out, then I can guide you better.
Okay, ma'am. Okay. And what are the blood tests and you suggest for this knee pain or something like that?
Yeah, so I can help you with that. Sure, just ping me.
Okay.
Okay,
Thank
now before I go to any other questions, there are some good questions in the chat. I want to quickly take that. First question is, are bow legs अगर है तो वो exercise से normal हो सकता है क्या? Good question. Bow legs is this. Na? The reason for bowing is because there are many reasons for that. But अगर foot flat है, collapse हुआ है, या foot overpronated है, all these reasons के वजह से bowing हुआ है. So if we address the cause, which is I might need to do insoles for you, I might need to work on some specific strength. कोई भी exercise करके नहीं होता है, corrective exercise करके. However, bow legs can be corrected about 50-60% depending on your age. अगर आप so if you're older than, say, I don't want to, my kids will call it ageism. I don't want to do that to anybody, but if you are over a certain age, you're a senior citizen, and the bowing, you've had it for many years, then of course completely reversing it is tough. But जितना जल्दी हम उसको पकड़ते हैं उतना जल्दी वो reverse कर सकते हैं हम. 100% sometimes not, but a good 60-70% we can correct. Okay, so that's a great question. Another good question was that any particular home footwear you can suggest, because you're standing at home for long. Okay, this is a good question. If you have knee pain, remember your foot muscles, आपका ये जो arch है, पैर के नीचे का arch, उसको अच्छे से support करो, especially if you're standing during the day a lot, और अगर आप walk कर रहे हो. Okay, so for that, what is the footwear? I'm not going with any specific brand, but you need to make sure that जो भी आप चप्पल पहन रहे हो, shoes पहन रहे हो, उसमें वो arch अच्छे से supported हो. Medial arch support is what it's called. If the arch is collapsed, then you might need external support, which is like insoles. Okay, and silicone gels do not work. Please make sure that you're using the insoles which are firm. I think I have an insole. No, I think I got rid of it. Okay, I could have shown you. Basically, I want an insole which is firm, not that thin one. Okay, so these are the two questions I wanted to take from the chat. Mr. Pratik. Pratik, ask me a question.
नमस्कार, मैं पूछ रहा था मैम, मैं साइक्लिस्ट हूँ, तो मेरे नी में आफ्टर आई एम 30 राइट नाउ, 31, सो मैं जब बैठता हूँ ना, एक कॉन्स्टेंटली गेट क्लिक पॉप एंड ग्राइंड साउंड, और व्हेन आई गेट अप एंड देन द सेम इशू, एंड बिहाइंड अ बिट पेन बिहाइंड द लेग, और लेग्स टायर्ड भी रहती हैं. सो व्हाट इज द चैलेंज? एंड डाइट वाइज एवरीथिंग इज, मतलब मैं घर का सादा भोजन ही खाता हूँ, और वही बेसिक जो हमारी
जनरली. So what is your problem? Is it जो नी पॉपिंग है वो प्रॉब्लम है या पेन प्रॉब्लम है?
पॉप में कोई जो नी की पॉप की साउंड है, जो चटकने की आवाज है ना, वो उसमें कोई दर्द नहीं है.
उसमें दर्द नहीं है ना. हाँ, तो जनरली दैट ओनली, उससे ये नहीं हम बोल सकते कि अंदर इंटरनल डैमेज है. जनरली अगर नी पॉप होता है और उसके साथ पेन है, तो दैट इज समथिंग मेडिकल. मतलब आपको वो इंटरनली चेक करना पड़ता है नी ठीक है कि नहीं. लेकिन अगर पॉपिंग हो रही है, नी में आवाजें आ रही है लेकिन दर्द नहीं होता है, इट कैन मीन दैट आपके मसल्स वीक है. तो अगेन साइक्लिंग में द प्राइमरी मसल यूज कौन सी होती है? थाई मसल्स. आप थाई मसल को स्ट्रॉन्ग करो, और साइक्लिंग से आने के बाद थाई मसल्स को फोम रोल करो. सिर्फ इतना करो, उससे बहुत फर्क पड़ेगा.
जी 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 बिल्कुल मैम. जिस प्रकार की मैं खेल खेलता हूँ उसमें ना हम थोड़ा जंप्स वगैरह ज्यादा करते हैं, तो उस पर इम्पैक्ट आता है. तो क्या अगर हम कंक्रीट से मड की तरफ जाएं तो हम लॉन्ग टर्म गेम को भी परसिस्ट कर सकते हैं? क्या करें? तो जैसे हम साइकिलिंग में करते हैं ना, परफॉर्मेंसेस होती है, जंप्स वगैरह करते हैं, है ना. तो अगर कंक्रीट की जगह अगर हम मड की तरफ जाएं, जो कि फ्लैट मड होती है मिट्टी, तो आई गेस दैट वुड बी मच सेफर, राइट?
Yes,
just
that is safer.
knee training should, yes.
That is safer, yes, but that's a temporary solution, ना. Long term solution क्या है कि strong करना है ना नी को, थाई मसल को.
जी.
फिर तुम वो भी कर सकोगे. फिर उसमें भी तकलीफ नहीं होगी.
तो बेसिकली मैम वही नी वर्कआउट से ही होगा, मतलब इम्प्रूविंग द नी अराउंड मसल्स, है ना?
Yes. Okay, guys. So that's thank you so much. We are ending the session. We are at 1 o'clock almost. So now let me ask you one question. Was this session helpful to you? Is there something that you got? Okay, short. आपको कुछ clue आ रहा है कि नहीं मुझे ये 2 चीजें करनी चाहिए? Tell me in the chat. Any more questions? We can take them in the group. But otherwise, tell me if it was helpful. Tell me specifically what was helpful. If there was one thing that you learned, कि बस आज से ये करेंगे तो will help. Hopefully, everyone took away something. Structured approach for strengthening. Yes. Sequence. Yes, sequences. Great. I think you guys have taken away the good stuff. You've understood. Good crowd. Thank you guys. Strengthening the glute first before strengthening the knee. Yes, absolutely. Excellent points. So great. So if you want to, do you think that a structured way of working with the knee will help? If you think that yes, that the next step to do is to work with a structured exercise program for the knee, tell me if that's something that you think that you've learned from this, that you would be interested in making your knee strong. Do you think that would be a good idea? Just tell me in the chat. Yeah, Vineet? Yes. Yeah, great. All of you agree? Superb. So there is a structured way to work on the knee. Those of you who are interested, I can guide you further. But for everyone else, everyone needs to start working with basic knee strength, which is the VMO. मैं group में वो video डालूंगी. Please वो try करो. 4 exercise in sequence, 1, 2, 3, 4, all exercises, please do. And those of you who want to come see me in the clinic, please connect with me one-to-one, and I will give you an appointment. Those of you जो मुंबई में नहीं है, अगर online consult करना है, let me know as well. Anybody here not from Mumbai? Pune? Okay, great. Delhi, Pune. Okay. Okay. So those of you who are not, a lot of these resources I can make you available to you via WhatsApp. Okay, so connect with me, whatever you guys need. Acha, Ludhiana, Nasik, superb. Good to see a lot of people from not from Mumbai as well. So thank you so much, guys, for being here. I hope this will help you get rid of your knee pain, make your knees stronger, and help you live the way you want to do. Whatever you want to do, you should be able to do. This is my belief. This is my strong passion to make everyone be able to do what you want to do without any limits. Okay, so thank you so much for attending, and keep your questions coming in the group. Sunday hai, I'm sort of free, so I will answer all your questions. And jisko appointment chahiye this week, try to come into the clinic so we can get a basic assessment done to get you started for knee. Okay? Bye, guys.